Disclaimer. RN Nurse 411 is providing information to help patients, individuals, and families understand their health, healthcare, and the health systems better to be informed and in the know on making the best choices important to their health. This is not a platform that takes the place of seeking professional medical advice for a new and/or ongoing condition that needs one-on-one care with a medical provider. Seek help immediately by a medical professional for immediate care or call 911 if it is an emergency. Just remember, if it's an emergency, stop what you're doing, pick up a phone, and call 911 and seek help immediately. Welcome back to RN Nurse 411. This is Nurse Ivy, and let's go on to episode 2. Today's episode is about an article that I came across online through Live Science. It's an online publication that brings you a lot of information regarding different things on health, but this particular article caught my eye and wanted to share it with you. The title of the article was Deadly Case of Penile Gangrene Linked to Improperly Applied Catheter by Nicolleta Lanese. And if you don't know too much about Live Science, it's like an online news publication that has different articles pertaining to health, biology, physics, astronomy, and it really gives like just tidbits of information, interesting information. So when I saw this come across my news feed, I was like, I really did a triple take. Like, is this for real? Like, deadly case of penile gangrene linked to improperly applied catheters. So wanted to dig in deeper and learn more. So let's go ahead and take a deep dive. So here we have a 64-year-old gentleman who was admitted to the hospital after suffering a stroke. The patient unfortunately lost control of how he regulates his urine, and then he needed a urinary sheath catheter, or what is simply called a condom catheter that drains urine via a tube into like a collection bag or container that hangs below the bed. So just fast forward through the article, the patient was discharged home with his condom catheter, and the same patient returned to the hospital 10 days later, according to the article, with fever, pain, and brownish black discoloration of his penis. As soon as I read that, I said, oh my gosh, he returned to the hospital with all the signs of an active infection. And what's worst of all, that active infection was located to his private region. And when they did the lab work, at the hospital, everything corresponded, according to the article, to a notably high concentration of white blood cells. That's a huge indicator of an infection has been brewing. He was given a broad spectrum antibiotic, and of course he was admitted into the hospital. Whatever infection he had going down in his penis has now become part of his bloodstream. And the guy is septic. They're treating him with fluids. They're treating him with antibiotics. The only way to treat gangrene when it's possible, feasible in this situation, they have to do something called a penectomy and a urethrectomy, where they remove essentially the penis. And then they were able to put a new duct for him to urinate out of. However, it's sad that this needed to happen just to kind of control the infection in his body. Now, I wanted to share this article with you because it just highlights for me as a nurse, and also something that I want individuals to understand if they're patients in a hospital, the importance, whether it's the patient, their families, their caregivers, their friends, whoever's going to be helping this patient when they go home, to understand all the details and aspects of their discharge instructions, the continued care that is needed after being released to the hospital. Because in this gentleman's situation, he was sent home with a condom catheter. And if many of you don't know what this is, a condom catheter, it's an external device. Sometimes when you hear the word catheter, you think, oh my God, they're putting something into me. But this particular catheter, it's an external device. It's a condom. And at the very tip of the condom, it has tubing that drains the urine away from the penis. down into a collection bag or chamber or container, however you want to say it, whatever makes you understand that the urine's being collected into a bag and it's below the level of the bladder, because we want to make sure things flow out of the body into the collection bag or container versus above the bladder, that the urine's going to flow back into your body. And we don't want to do that. In this case, we want to make sure that the urine is flowing freely, that the collection chamber is below the level of the bladder, and that, we want to reduce and minimize the risk of infection for this particular patient, especially if you're staying in the hospital. So other than the traditional urinary catheter that will literally be put into your urethra, as many individuals may know it as your urinary canal, into your bladder, and then a little balloon is inflated to hold that catheter in place as the urine is drained from your bladder through this tubing system into a collection bag below the level of your bladder. So it's just really important for people to kind of understand the discharge instructions. And this is why I kind of really wanted to dig a little deep into this article, because that's the most important thing. Most important thing for individuals. If you're going to be leaving the hospital, like in this gentleman's case, he had a stroke. And I'm pretty sure before he had his stroke, he was probably using the bathroom regularly. I don't know, the article doesn't go into detail as to, was the catheter applied at the hospital? Was it applied at home? It just says wrongly applied catheter. And I was like, oh my God, I just got to read this. How did this happen? And it really just boils down to making sure that you understand your discharge instructions. Whoever's your partner in crime caring for you understands the discharge instructions. Your family members, your friends, your lover, your partner, whatever. And you, the patient, make sure that you understand your discharge instructions and you know what you're doing. So like this gentleman, he left the hospital with a condom catheter. So I want to make sure that you understand everything that you need to know on how to use that catheter. So if this gentleman, as it pertains to this patient's case, he was sent home with a condom catheter. Now, if I was the nurse in the hospital about to discharge this patient, and of course during their stay, they're usually there for a few days, especially a stroke patient, maybe a week or two, depending upon the severity of the area affected and how well the brain heals and the improvements that are made, for the medical providers to see, are there improvements being made? Is there a new normal for this individual? And in his case, his new normal was couldn't control his urine. And so he had to go home with the urinary catheter. So the most important thing is that you understand your discharge instructions. And for us, is that making sure that we educate the patients and their family, like in this gentleman's case, how to properly use the condom catheter and make sure it's secure around the penis, but not too tight around the area that you prevent, good blood flow to the region. Ensuring that the patient and the family member just checking to make sure there's no kinks in the tubing, that, the urine is flowing freely down into the bag, that the urine is a normal color, and that the bag is located below the bladder. Because once again, we don't want the urine returning into the body. We want it to go out of the body. And we also want to minimize the risk for infection. And then also, daily condom catheter care checks. We want to make sure that everything is working properly. We want to make sure that the area is clean and to make sure that the skin color is normal. There's no rashes, no skin irritations or tears around the area. And then also change out the device. These are devices that get changed out daily. So depending upon what type of condom catheter you have, manufacturer specifications, your nurse will let you know that you need to change this device out daily, especially when it's soiled. And you always want to make sure that your hands are clean. Wash your hands with hot soap and water for 20 seconds. Make sure the area where you're going to be placing your materials is clean. Make sure your body in that area is clean. And once again, we're trying to minimize risk of infection. So, I really hope that gentleman got all that information when he was discharged from the hospital, or his caregivers or family members. Another item that's listed in discharge instructions that, from what I've seen in practice, is how to recognize the signs and symptoms of an infection. So how to recognize the signs and symptoms of infection. And it may not say signs and symptoms, but it'll say, if you start to have experience fever, 101 degrees Fahrenheit or higher, sweats, chills, loss of appetite, feel weak, unable to drink, hold down food, you're not acting yourself. And all of these are like new and worsening symptoms, even along with like shortness of breath, and you're not acting the same, or you're not alert, or your family members can't understand you because you're not making sense. You're not coherent with how you're communicating to them. And despite taking over-the-counter medications and any medications that your medical provider prescribes you upon discharge, and none of this seems to be helping, then you need to call your doctor or go straight to the emergency department or call 911, especially if there's a change to your level of alertness or experiencing shortness of breath. Those are all signs of an emergency, and you need to call 911. And I am going to put a little soapbox moment here about calling 911. There are times that family members at home will recognize that their loved one or even themselves are having like a serious health problem. And they're like, oh my God, should I be worried or concerned and go straight to the hospital? And there are times where you can take yourself to the hospital and drive yourself. That's great. But there are times that it's critical, life-saving critical, that you just need to call 911. Shortness of breath, someone's not acting the same, someone's grabbing their chest, someone's passed out, but still got a weak pulse. Call 911. The EMTs, the paramedics, the fire department, first responders, they know what to do in an emergency. When they get to your house, they're going to immediately assess, treat, and get them loaded and to the ED. And life-saving measures can start in the back of the box, immediately in the back of the box, versus that person in the car deteriorating en route to the hospital until you can get them there, until they could get triaged, until they could get seen. And don't get me wrong, I've seen people dragging or dropping. Sometimes I watch Law and Order. I'm a Law and Order fanatic. And it wasn't until I worked at an ED that I realized, you know what? This is real life. People tuck and roll. Ambulance bay, people pull up a car. They roll somebody out of the car, close the door, and they roll on out. They leave that person on the floor in front of the double doors of the ambulance bay, and we have to run out there and grab the person and take care of them because they either don't have a pulse or a weak pulse, and that's an immediate code that we got to run. So please make sure, just call 911 in those type of circumstances, because treatment can start at the back of the box. And we can get your family member there as soon as possible, or yourself as soon as possible, and start the ball life-saving treatment at that. So what is sad in this gentleman's situation is that the infection spread from a local area, which was his private region, and then it seeped into his bloodstream, and the infection flowed to his whole body. And this patient became septic. And he waited so long, 10 days. He became septic, went into septic shock. And despite all the efforts the medical team and providers took to save his life by removing the dead tissue, aggressive antibiotic therapy, and fluids, and medication management for other signs and symptoms, his body was overwhelmed in the fight of this septic shock, syndrome that he was in. And his body began to shut down, and he passed away. So that's really important for me to... This is why this article was really important for me to share with you, because according to the CDC, sepsis is the body's extreme response to an infection. And it's a life-threatening medical emergency, and people really, truly don't understand that. They just think it's an infection. All right, just give me antibiotics and I could keep on moving and keep on walking and everything's going to be fine. But what you need to understand is that depending upon the person, how long they had the infection, what they've been doing to take care of themselves to fight the infection, and how many days they've been in that state, and then anything else that they may have, any other comorbidities or other health issues, can just really snowball this into a serious life-threatening event. And so one of the things people don't understand is that sepsis happens when an infection you already have in your body triggers a chain reaction response through your body. And any infection can lead to sepsis. So infections that can lead to sepsis most often start in the lungs, urinary tract, skin, or gastrointestinal tract. And without timely treatment, sepsis can rapidly lead to tissue damage, organ failure, and death, all according to the CDC. And I'll make sure to post resources and stuff in the bio and the link below. And so here's another soapbox alert, because I feel like, soapbox alerts are really important. Sepsis can lead to death no matter what the infection. So please, if you or your loved one has a fever and begins to feel very ill, they're sweating, they have chills, loss of appetite, difficulty breathing, change in alertness, and not acting themselves, bring them to the emergency room immediately or call 911. When you arrive in the emergency department, hospitals have protocols in place to help minimize the loss of life by identifying and treating sepsis immediately. So according to the CDC, anyone can develop sepsis, but some people are at a higher risk for sepsis, like adults 65 or older, people with weakened immune systems, people with chronic medical conditions like, let's say, diabetes, lung disease, heart disease, cancer, and kidney disease, just to name a few, people with recent severe illness or hospitalization, people who survived sepsis in the past, and then children younger than 1, but really it can happen in any age bracket if overlooked. A person with sepsis might have one or more of the following signs and symptoms: a high heart rate, anything greater than 100 beats per minute, or a weak pulse, anything less than 60 beats per minute. Confusion or disorientation, going back to what I was mentioning earlier, that there's a change in alertness or someone's not making sense. That's just letting you know that something's changing for them mentally because their body's fighting an infection. Extreme pain or discomfort. Signs of pain and discomfort is not normal. Unless you are a chronically ill patient with a certain condition and the pain is being managed somehow through medication or treatment, severe pain and discomfort is not normal. That's your body giving you a sign that something's wrong and you need to check it out. Shortness of breath. You should not be starving to catch air or having difficulty taking a deep breath and feel like that you took a good breath and that you can breathe in and breathe out. If you start noticing a change in that and it's consistent, that's not normal. Those are extra signs and symptoms that go along with, hey, we may be traveling down the pathway of sepsis. And then clammy or sweaty skin. Clammy or sweaty skin is not normal, especially when you notice that there's a change in color, like a change in the color of their complexion. Like if you notice like the color has left their face, they look pale, especially with some of our individuals that have darker skin tones, either olive or brown or even black. A change in their color, you can tell. When they look pale, their skin starts getting dusky or gray. From what I've seen in serious codes and things of that nature, when someone's really, really ill and they have, skin tone complexions, you got to be able to recognize those signs, especially just a normal person. If you know that person doesn't look right and their skin color doesn't look like their normal skin color, something's up. So just once again, these are just one or more of the following signs of symptoms that you're heading down the pathway of sepsis. And remember that a medical assessment by a healthcare professional is needed in order to confirm sepsis, according to the CDC. So please, my soapbox alert. Sepsis can lead to death no matter what the infection. Just recognize the signs. If you've been treating fever and feeling unwell for a day or two and nothing's happening with over-the-counter medication or treatment or whatever the medication that your medical provider gave you when you were discharged from the hospital, return back to the ED or call 911. Now, with this gentleman's story, it's really sad. It's really tragic. The loss of life is never easy. As a nurse, you always want to desire the best outcomes for your patients. And this is why it's so important for patients, their family, their friends, their caregivers to understand all the details and aspects of their discharge instructions from the hospital before leaving the hospital. Based on why you were admitted to the hospital, your discharge instructions will detail everything you need to know and follow about your continued care at home or at a rehab facility. Because sometimes people get discharged home, and then sometimes, especially when it comes to a stroke, anything neurological, like if you don't return back to your baseline, more than likely you're going to go home with care, or you're going to go to a rehab facility to get a higher level of care until you could get back home to a new normal, is what I usually tell individuals. So here are a few takeaways I want you to know. If you are being discharged from the hospital, especially after reading this article, make sure you and your caregivers understand all the information that is being provided to you and the next steps needed for your continued care at home. If you're being sent home with a device that may be temporary or permanent, please make sure you know how to properly use it, change it, replace it, and support a clean area and environment around the device, and handle all tools and equipment with clean hands. Always. Recognize the signs of infection and when to return to the emergency room or call 911. And remember that sepsis is a medical emergency. Go to the emergency room immediately or call 911. Remember that the ambulance can start life-saving measures in the back of the box versus you taking yourself or someone taking you to the ED, and maybe those 5 or 10 minutes can make a huge difference for your care. And when all else fails, ask questions to your nurse and medical providers to make sure all your questions are answered and resolved before you're discharged home. Thank you for listening to today's episode of RN Nurse 411. All the best to your health, Nurse Ivy.